Hi, today we wanted to talk about the health at every size movement and the principles that go along with that. And I think this is of interest to us because we've been really diving into intuitive eating, and the intuitive eating camp, although that was created by two dietitians, they really support the health at every size movement, right? And
Right.
how would you in a nutshell kind of sum up health at every size as a movement?
Yeah, I feel like the main gist of the movement or the principles is to validate that people can be at any body size and still strive towards health, and also that they don't have to feel bad about themselves. They can kind of strive
Right.
towards body acceptance or body
Right.
positivity.
Right. So there's really an emphasis on body acceptance and a shift away from making weight loss any kind of objective, right?
Right. And I found that they were quite aggressive about that. They really say, no, we're not going to look at all at weight loss as a goal, and
At
really
all.
it's at
Yeah.
all. And really, we want you to put your focus on health promoting behaviors, and that seems to be the main focus of their
Right.
principles.
And just, I guess, as a bit of a preliminary background here, there is some research that shows people that practice intuitive eating and follow health at every size, they do experience less psychological distress because they're not obsessed with food as much and they're not trying to diet. So
Exactly.
I
And they
think
seem
that
to
would
really encourage people to let go of trying to fit themselves to an arbitrary
be
model
beauty
and
standard or something like
exactly,
that.
and just
Yeah.
focus on what are ways that I can promote health that aren't about weight loss or fitting a
Right.
certain body
Right.
size.
Yeah. And so I guess we've already jumped in, but we do just want to talk about really the benefits of that movement and then also some of the blind sides. So as we've already kind of said, one of the best things about it is a shift of attention away from people's weight and shape to having health promoting behaviors, such as encouraging them to exercise.
Oh, right, exactly.
So that's a good thing.
And also thought one thing that I appreciated that they did is point out the damage that some people experience trying to endlessly diet and kind of that yo-yo effect.
Right,
And
right.
even though I know we'll get into later maybe some of the blind sides of that view, I did agree that for many people, they have dieted off and on for years. It's been very
Right.
unsatisfying. It's kind of
Right.
damaged their self-esteem. They have a sense of being a failure.
Right. I think some of the statistics that I've read about dieting is within 1 year, the majority of people will have gained back 30 to 40% of what they've lost. And then if you look out 2 to 5 years, most people will have gained back, what they lost, then some. And so people can get really into this pattern of diet cycling, and the long-term risk is that you wind up heavier than you were originally.
Right. And given all those stats, I mean, I get the allure and the attraction of being able
Right.
of just saying,
Right.
hey, I'm done with new diet plans and I'm just going to work on it,
Yeah.
even embracing who I am and
Right.
focus on other ways of trying to be healthy.
Right.
That must have an attraction to a lot of people.
I think it does. And I think that's one of the things that it does well is that it kind of underscores the potential risks of dieting. And some of the research shows that when people get rid of dieting, and they can just be more accepting of themselves, that their weight actually, for some people, really can stabilize. Now, unfortunately, the research on the health at every size and health at every size, there's more research on intuitive eating, but the research into health at every size is kind of limited, and it's mostly been with certain populations. So
Right.
we don't know how broadly applicable this will be yet, right?
Exactly. And I delved a little bit into the research, and it kind of echoed exactly what you said. It seemed like there were some studies, of course, cited by the movement that have shown some positive outcomes,
Right.
but limited,
Right.
and definitely the jury's still out.
Right.
And also weight loss was definitely not something really shown in a lot of those studies that
People
actually
don't,
was effective.
right.
And of course, that's
Right.
not their claim.
Right. People are not losing weight if they practice
Right.
intuitive eating and health at every size.
Right.
And it's not designed to do that. What about body image and body acceptance? Do you think that's one of the positives?
Yeah, I do. I mean, if I kind of think about the history of growing up in a culture or community where thinness has been traditionally very emphasized, and if you haven't fit that standard, that's a real, chip on
Yeah.
people's shoulders. And to get to a place where you're deciding not to be apologetic about not fitting that cultural norm, and that you can even celebrate how you look even if it doesn't fit the cultural standard, I think for
Right.
some people is a
Right.
positive experience. Of course, can it go too far? Something we'll talk about later. But I
Yeah.
think as a general thing, if that liberates people from guilt, from feeling like a
Right.
failure, and being able to appreciate kind of who they are,
It's much kinder,
I
right?
think so.
And so that kind of goes into this another point we have here, which is, positive body image doesn't mean that you like all aspects of your body necessarily, but it means you can appreciate it, you can treat your body with respect, and you can start to focus on function over just appearance. And I think that's one of the principles probably too of the health at every size.
Exactly. And I feel like that's one of those health promoting behaviors that they do endorse, even though we're kind of disallowed to focus on weight or weight loss. But
right.
hey, you can exercise or, celebrate aspects of your body. Those would probably be health promoting behaviors that the movement would endorse.
Right. Active embodiment. What do you think they mean by active embodiment? You got thoughts on that?
Yeah. So active embodiment, I think it's partly about shifting the attention from how you look. So, kind of your body size or shape in a mirror, the aesthetics, to kind of what your body can do, and that those health promoting behaviors that improve your function or just your pleasure of being in a body would be probably something endorsed or embraced by the movement.
Right. I would add to that maybe, and I'm not actually sure if they go this far, but when I hear active embodiment, I think of somebody being embodied means they're present in their body. They're having a relationship with it. They're not dissociating from their body. And so I think probably if we think about health in a broad sense, being embodied is probably healthier than kind of checking out from your body and not being in tune with it, right? Because if you're not in tune with your body, you don't know what it needs. You may be missing pain signals, hunger signals, satiety signals, those kinds of things.
That's a really cool point because, so often the focus when we hear people talking about their bodies is negative or at least aspirational. They want to look a certain way. They're not there yet. So rarely do you hear people talk about kind of the pleasure of just being in a body, how it's kind of a unique experience, right? As a human being, we're only in this journey for a while. We're in these bodies, and it's not talked about a lot, celebrating that active embodiment.
So I think this is a call to, be present with your body, to be an ally with your body.
Right.
And an ally would mean that you're working with it and not abusing it or hating it or things like that.
Right. Well, I was curious what you thought the good parts they put of their focus on destigmatizing people who are in larger bodies. That seemed to be a big focus of it.
Yeah.
What aspect of that did you find helpful?
I think that is helpful. I've talked to a number of clients over the years that are in bigger bodies, and their experience going to the doctor was that there was right off the bat kind of this assumption that their health problems are being caused by their weight, and maybe in some cases that really wasn't true. And so I think that we all could work to probably destigmatize people's weight and shape, that there are so many factors that go into that. And I think we probably want to take the emphasis off of any kind of blaming approach, for the individual.
Yeah, I like that. And I could definitely imagine, I don't know to what extent this is still true, but historically, people might, in our culture with the value of thinness, might have associated certain negative like character traits or behaviors with being larger. And in many cases, those may not have actually applied, but people may just have assumed that or projected that onto people in larger bodies. So I get that.
Like being fat maybe had a bigger connotation of certain negative characteristics, right?
Right, exactly. Yeah. And so I feel like they're taking aim at that, and rightly so, because that's something that would bring people down and has a judgmental flavor, I guess, to it.
Yeah. Absolutely. Right. So there's also an emphasis on, I guess this kind of goes back to health aspects or principles that are separate from weight loss, but eating for well-being, and not just to kind of diet, right? It's really an anti-diet approach, right?
Absolutely. And that reminded me a lot of our conversation about intuitive eating, because that was kind of a similar approach there where, hey, embrace food, enjoy it. It's about pleasure, honoring whatever you want to eat and trying to kind of allow that to guide your eating habits rather than trying to fit a certain standard or look a certain way.
Right. One of the things I think it does really well is it validates for people if they've tried to lose weight and they've had a really difficult time. It validates for them that, it may, for a lot of people, as we look at that research that we said, it's kind of it's not being very successful. We need, a different, if that is an important thing, then a different approach needs to be had besides
Yeah,
just highly restrictive diets, right?
I
So
agree
I think it
completely. And I can
validates that.
imagine if someone has dieted off and on and feel that they've been unsuccessful, maybe they kind of have taken it personally and seen that
Yeah.
as I have some kind of deficit.
Yeah.
And then to hear that statistic you quoted might be helpful to realize actually many people really aren't successful long term. With weight loss, so I don't have to take it so personally. It's something that's just extremely
It's
difficult.
kind of just the nature, I guess, of the
Right.
situation, right?
Exactly.
What else do you think it does well?
I thought, there was a lot of emphasis on, and I think you mentioned this briefly, reforming healthcare so that, people are validated, that medical professionals aren't making negative assumptions with assuming there's
Right.
no evidence there to support that, and that
Right.
people are treated equally regardless of size. So I guess it goes back to that stigma piece, but wanting to
Right.
see that reflected in
Right.
the public arena, be it healthcare or schools or any other places where people kind of collectively gather.
Right. Right. And so, kind of to top off some of the benefits of the health at every size principles or movements, is that there is some research that shows there are improvements in people's physical and mental health when they practice the principles, and maybe even weight stabilization.
Yeah, and I definitely, the mental health improvement makes a lot of sense to me if people
Right.
are reacting to this in a way that's liberating that shame and guilt piece,
Right.
because that
Right.
obviously is usually a negative
Yeah.
factor.
You can't be experiencing well-being if you're hating yourself or feeling chronically shamed or things like that.
Right,
And as a
exactly.
matter of fact, there is some research that shows, when we're really stressed out all of the time, and I think being chronically shamed would certainly count as that maybe we don't even absorb nutrients from our food as well, So there's a lot of, interesting counterintuitive things that have gone on within the realm of nutrition and dieting and all of that.
Yeah, well, that's a great point, and it shows that psychological improvement is not disconnected from even physical
Right,
improvements to health.
right, right,
Well, I feel like we've covered really well a lot of the benefits. Let's get to the blind sides because I know we both had some concerns about
right.
aspects of our interpretations of the health at every size principles or movement. Start us off. What was one of those for you that you felt was problematic?
I think one of the biggest blind sides is that I think they want to kind of get away from talking about weight and obesity so much so that I think they completely downplay or minimize the health risks associated with obesity, especially when you get into the greater classes of obesity, like class 2 and class 3. We certainly know there's a whole bunch of medical literature that demonstrates, all kinds of health risks associated with those classes of obesity, such as type 2 diabetes, hypertension, cancers of various sorts, gallbladder disease, coronary artery disease, strokes, so forth and so on. I mean, even just things that we can observe, like difficulties with movement, right?
Right. Yeah. No, I thought that was one of the weakest aspects. It's one thing to tell people don't blame yourself, liberate yourself from the shame and guilt, and
Right.
even
Which is
celebrate
good.
your body size, and it
Right.
doesn't need to fit a certain standard. But to give the suggestion that there aren't very real health consequences to obesity
Right.
is misleading and kind of
Right.
disingenuous because those are known health risks.
Right. And this is something we didn't really say kind of in our background about health at every size, but it really has some roots in a movement in the 1970s about fat liberation, like really trying to liberate people from I guess aesthetic standards of the time about thinness. But you had really eloquently put here, that fat liberation from shame and guilt is possible, but you cannot liberate yourself from health consequences of obesity. Right. And
Exactly.
so I think that's a really well said statement.
Absolutely, because I feel like this movement conflates those two, and they're kind of separate points, right? Be
Right.
free of the shame and guilt,
Right.
but of course, objectively acknowledge there are certain consequences to being
Right.
a certain size, and you're free to ignore those, right?
Right.
It's your call,
Right.
but we can't deny that that's an important factor that people would
Right.
want to
Right.
take on board at
That
least.
there's a reality here, I think.
Exactly.
So are there times that a person may have a legitimate desire to lose weight? What do you think?
I think absolutely.
Yeah.
We can imagine someone who is a larger size and perhaps has developed a health condition where they could get a lot of relief by with a modest weight gain. And of
Yeah,
course,
sometimes
it's
even 5 to 10% weight loss, right?
right.
Can really vastly improve health.
Exactly. Exactly. And of course, it's still, it's not their obligation to do that. They have the freedom to choose, but to suggest that there's no potential benefit and that you shouldn't try for that, I think
Right,
is not empowering, actually, which is what they
right.
claim to want to be doing.
Right. So for a movement that really talks about being health size inclusive, maybe, there's some limitations to that for
Yeah,
them.
exactly. And I think for me, another way of looking at that in terms of a downside is I get that they want to liberate people from really historically some bad ways of looking at people who
Sure.
are in larger bodies.
Right.
But if we go so far that we ignore like health risk,
Right.
or we perhaps look skeptically at people who say, I still want to lose a little weight, I just don't want to take on the shame and guilt, that's kind of really downplayed and even looked down upon, it
Right.
seems like.
Right. And so a person maybe, for instance, seeking bariatric surgery, if they come up against comments that they're fat phobic or, they're really just giving into diet culture, that's going to set them up. And we know this is true too. People that undergo bariatric surgery are actually at higher risk for suicidal thoughts.
Right. Exactly.
So
And it
this
kind of
might be
misses
part of that picture.
exactly. And I feel like they kind of miss maybe a little bit of a subtle point where I can embrace myself and have self-love and acceptance, but does that mean we don't then work towards positive change, for
Right.
example, a needed
Right.
health change or
Right.
anything else? And I feel like in other areas we would acknowledge, no, we
Right.
can just to self-accept doesn't mean you're never going to contemplate any
Right.
changes.
I think you're right. I think intuitive eating and the health at every size movement conflate diet culture with a healthy diet, right? I mean,
Right.
we all know that some diets would be better than others. In terms of what I mean is like if your overall picture of what you're eating is a lot of whole foods and whole grains and healthy fats and good proteins and all of that versus highly processed food that's available at fast food restaurants and that's all you're eating, we can see that there's going to be a big difference between those two diets. And those two things kind of get conflated, I think, as well. And
Absolutely.
so people might be discouraged from trying to improve their nutrition
And that
even.
reminded me of a similar downside of intuitive eating, where any attempt to parse healthy versus unhealthy ways of eating is kind of lumped into quote unquote diet culture, which
Right,
is seen as entirely negative.
right,
The implication is we're missing the point of what the movement wants us to embrace, and there's
right,
no way to kind of have that nuanced discussion
right.
of the
I
sort that you
know,
were
right.
making. Yeah.
Yeah, and I think what they mean by dieting is like a highly restrictive, kind of diet track where you're depriving yourself. Maybe you're not getting enough calories and not
Right.
enough nutrients. That's really different than somebody saying, I want to add more leafy greens and more
Exactly.
fish and
They kind of throw the baby out with the
yeah,
bathwater, right?
yes,
Because
right,
someone might say in a very healthy way,
right,
let me kind of strive in a very doable fashion to slowly increase some nutrients. I'm not going to do a lot of restriction. I'm not following a program. I'm not feeling
right.
shame or guilt. But yeah, I'm making some healthier
I
choices,
feel
and that
better.
matters. That
Yeah,
seems like they kind of
right.
bar that conversation from happening.
Right, right. I agree. Another thing I think that they kind of are down on is that, this idea that I think they eschew the idea that weight loss can, in some cases, prolong life. But I know there are some individuals that because their size has become so large, if you become bedbound because of obesity, your risk for mortality within 5 years is pretty high. And so
Exactly.
a person that's in that situation, for instance, losing 20, 30 pounds, they might start to really reduce that risk. And I think that's ignored within these
Absolutely.
concepts, right?
And I agree with them that, at any size there are a set of non-weight loss related behaviors that could be
Right,
set to promote health. But
right,
if we're blunt, as size continues to increase into dangerous levels,
right,
it kind of becomes a little disingenuous to say,
right,
well, hey, you can focus on other behaviors. Will we say, you know, health at any blood pressure reading or health at any alcohol or addiction level
right,
usage? As it becomes more acute,
right,
we would actually want to focus more attention on the thing that is literally creating a life and death
right.
risk.
Because the weight, right, it shouldn't determine a person's worth or how they're treated, but the weight is an indicator to some extent. It's correlated with some of those behaviors, right? So
Right.
a person that's engaging in a lot of binge eating, I mean, there's going to be a consequence of that we see in their weight, right?
Exactly.
Now,
Yeah.
sure, what we should be focusing on is helping them improve their psychological health so that they're not engaging in binge eating anymore. But there's still this other piece of it that is
Right.
relevant, right?
Exactly. And that kind of made me sad because I feel like the movement's coming from a place of these historical kind of prejudices and wrongs, and that has weighed so heavily on people, no doubt, right? But that now we can't even have a conversation about some of these objective realities, that somehow gets us on unhelpful terrain, I guess just shows me how, we haven't brought back in the nuance. It's still more focused on just shirking off the shame and guilt, which is very needed.
Right.
But it kind of stops there, I guess, because there's no avenue for talking about commonsensical ways of, taking weight loss into account due to a health condition, or making small changes that are more doable
to nutrition,
right?
That could be that's not necessarily embracing diet culture,
right?
And so while there's a lot of good here in the health at every size principles or movement, it can, I think we're saying it can be harmful if we completely ignore risks associated with obesity,
right?
Especially at the higher end of that scale,
right? And what was your sense, one word that came up a lot, or phrase, as I was like kind of looking at some influencers discussing the health at every size movement, is, thin privilege was kind of bandied about a lot.
Sure.
What was your take on that?
I think, similar to how we might talk about other sets of privileges, that our culture and our society has bestowed upon people a certain set of privileges for being thin. We'll just take, for instance, like you might fit easier in certain spaces, like on an airplane. You might be treated better. You might be given preferential treatment, like even for a job. I think there are some studies that have shown people that were in thinner bodies maybe had a higher chance of getting certain jobs than people that were heavier because of negative stigmas. And so that's one of those good things I think the movement tries to do, is to destigmatize people's weight and shape, because two people, and we know this, two people could be on the same meal plan, they could be doing the same exercise, and they're not going to weigh the same or look the same exactly, right?
Yeah, exactly. Yeah, and I think the only I agree with all of that. The only problematic aspect that I saw of the thin privilege focus was, in some cases, and this may have been unique to some of the influencers who were talking about it, I don't know how broadly representative is of the movement, but it was kind of used as a way to critique efforts to talk about some of the misnuances of the sort that we've covered here, where that's our thin privilege talking, that we're kind of wanting to, for example, consider weight loss under certain cases as being something that's worthy to bring up, and that's somehow us being shameful towards projecting shame onto others.
A skeptic might say, we don't have legitimate concerns about people's health. We're just still trying to protect thin privilege.
We're kind of within our bubble of thin privilege, and we're just kind of talking from that space. And I felt while that can happen and we need to be aware of that, I would hate for that to close down every conversation, every discussion. I think awareness is needed on that point, but that there's a way to talk about it,
right? And so I think, there's got to be a way to kind of be in the middle here, where we recognize there's a lot of great principles here of encouraging people to move, encouraging people to focus on their health, not what they look like, not their weight per se, maybe, to embrace themselves, to care for themselves. On the other hand, I think there is just very clearly, some unfortunate realities that, there are health concerns associated with obesity, and we ignore those at our own peril.
Exactly. And to be fair, I think every movement, because it has a few things that it really wants to do and do strongly, tends to kind of overlook other aspects. We talked about that with intuitive eating, and there's a lot of overlap here in terms of the desire to liberate people from the shame and guilt, which is very noble, right? But sometimes that focus can come at the expense of considering other aspects. Yeah.
Right. Well, and for so long, diet culture reigned supreme, that you should be wanting to be as thin, as you can, or not have any excess body fat, right? Was kind of the value, and it was kind of this fundamentalism.
Yeah.
But the risk is in trying to push back against that, we create another kind of fundamentalism.
It's a great point.
There's nothing wrong with any kind of, extreme weight gain, or, which wouldn't necessarily be true, right?
Which is kind of a weird paradox of every movement, and attempting to define itself as a movement or a set of principles. One, they can start to police the boundaries of their own thing, and sometimes one can be criticized by straying beyond the permitted or allowed areas of conversation, right? Because it loses cohesion if we go too far in those directions.
Right. And in an attempt to try to make a simple, parsimonious message, yeah, you might kind of create a fundamentalist message, right? Almost like, maybe, if you want to be part of our tribe, you should be obese, maybe, or you should be.
Right, exactly. And that came up in some of the influencer videos where, and again, I don't know how represented this is of the movement as a whole, but there was not just an embrace of body size, but kind of a one-upmanship about how obese one was. And there was kind of a hierarchical ranking and a sense of bigger being better, really running with that message.
Right. Yeah. And so sometimes, like there is in other aspects of our culture, sometimes oppression, people that have experienced oppression are elevated in a way that's good, but also maybe in a way where they weaponize that against other people.
Right. And that's the main thing that bothered me in some of those videos is when I felt adherents of the movement or people who were mouthpieces for it were very critical of others who actually wanted to be part of it, but maybe weren't following some of the behaviors or brought up points that weren't widely embraced by the movement. It felt problematic.
And so I guess it just goes to show you, even when we want to be inclusive as humans, we may have a hard time doing that fully.
Sometimes it's such a fine line, right? Yeah, it's easy to go astray for sure.
Yeah.
Great. Well, we've enjoyed talking about the benefits and blind sides of the Health at Every Size movement. Tune in for more discussions.